All right. Well, thanks. I really want to thank the program directors, and I know a lot of them have left, but we had about 5 program directors that we knew were going to come, and to have that many, we probably had 30 or so here. I thought that was amazing. At least at my table, there was a lot of really good discussion about when to do your away rotation and what to expect when you get there and how to shine if you're a student who doesn't have a residency training program at your institution. So I hope the discussion was fruitful at the other tables as well. I think we're really lucky. Tom Morrissey talked this morning a little bit about the SVI. We have Dr. Frazier and Renee Overton from the AAMC who are really kind of the driving force behind the standardized video interview, and they're here to talk about it. And I think when I was just talking to them briefly, really the spirit of this whole symposium is to kind of belay your fears and let you know that this process is going to be okay. And we all kind of went through it, and you get a lot of anxiety about it, and then you get through it and you're like, I don't even know what I was worried about. And the SVI is the same thing. So I told them I was going to just take 5 or 10 minutes and talk about our experience at Ohio State. So every year about 10% of the class, or about 20 students, go into emergency medicine, and we advise those students. And this year, this past year, was the first year that each of the students was kind of required to do the standardized video interview. So you can imagine it being the first year, them having a lot of anxiety. I mean, I realize for you guys it's kind of the second year. It's still your first experience. So we met with our students, and we did like an hour-long preparatory lecture where we just kind of talked about what is this thing. So the standardized video interview, and I'm not going to go into a ton of detail because I'm sure they have better slides than I do, but these are 6 text-based questions. And the students video their response. They have 3 minutes to respond to each question after a period of thinking about the question. And they're behaviorally anchored rubrics that really no one has. It's proprietary to the AAMC, so we don't know exactly what's on that, what questions you're going to be asked. But we have a good idea based on the 2 competencies that they're trying to gain information about you. So think about it. So the program directors that were in the room and that have talked to you today talked a lot about how we get information on you about patient care. Well, how do we get that? We get it from the SLO, right? So we get it from the dean's letter. The dean's letter is going to talk all about how you did with the patient care competency. Medical knowledge. We get a lot of information about you about medical knowledge. We have your step 1 score, your step 2 score, and if you do the EM shelf, if you're at an institution like mine that requires the shelf in emergency medicine, we usually get that score. So medical knowledge is covered. These 2 competencies, though, are harder to get a grasp on, and those are interpersonal communication skills and your professional behavior. So professionalism is a difficult thing to quantify. I was speaking to a program director last night who actually told me that they looked at every SVI interview on their applicants. And the one thing that struck them the most is how close the applicant was on the video interview to how they were in person. And I think they weren't really expecting that. But to me, that was a good reflection of the fact that this is a pretty accurate representation of who you are. So I just wanted to show you, we did a little collaboration with Michigan, which is easy for me to do since they never beat us in football anymore. Although they did go to the Final Four in basketball. I won't mention that. But so what we did is at both institutions, we did an hour-long preparatory lecture. We had our students, we gave them 6 questions. And actually, I took the questions out of Ken Iserson's book, Getting into Residency. Have any of you seen or read that? It's a good book if you get a chance. Ken Iserson's an emergency physician, and you can get it on Amazon. I have no vested interest or disclosure. It has a good section on the interview. And so we picked 6 questions, and we had our students answer the questions how they would do it for this. So we told them, we want you professionally dressed, we want you in the room that you're going to do it, and we want you to put the video in a Dropbox. We're going to look at it and we're going to give you feedback. And I think it was a really good exercise for kind of both them and for us. So we looked at appearance and professional dress, technical aspects of the recording, the speaking technique, and the organization of content. A couple of things that we noticed, some of the folks, you know, tie was not all that straight. One of the students, the camera was like just kind of catching them from like the eyes up. I mean, these are things that you would want to know, right, prior to that happening. One of the students had on like really distracting, very nice looking, but earrings that were like kind of dangling, and you know, it was a distracting thing. And I know the raters are trained to not care about that stuff, but it's hard not to notice it. So why not eliminate those things? The position of the laptop was a big thing. It's hard to get practice with actually speaking into a laptop, right? I mean, that's not something that we do well. I mean, maybe you guys are better at it. I mean, you're the kind of the Google Hangout, FaceTime, Skype. I mean, we're all dinosaurs getting used to that. But so to really speak into the camera was another thing. We had students kind of do this eye roll thing when they're thinking about what to say next, and also tics. We do a lot of ums and uhs, and you know, unless you watch yourself on tape, it's really hard to I said it, see, but I picked up on it. It's hard to get rid of those things, and so we really want to make sure that you are ready to go for this. So I'm just giving you these slides as an example of something that we did at Ohio State. I can tell you that what I know about the SVI from the program directors that I've spoken to is if you have a low score, you know, they're going to pick up on that and kind of wonder why. And I'm happy to report that our students scored between 16 and 26, all of them. And so nobody had a score that was kind of a red flag, and actually some of them did quite well. The other thing I'll tell you is this. They might have done the same without the prep program, right? But my impression of it is it forced them to sit down, go through the practice of putting on some professional attire, take down their, you know, the posters and the empty beer cans and whatever's in the background of their room, and make sure that they did a nice professional video. So I would recommend something similar, and your institution may do something like that. If they don't offer something like that, I would go through this exercise and just make sure that you're well rehearsed. So that was our experience. You know, some things that I'll leave you with, the patient always comes first when you think about how you're answering these professionalism type questions. They're going to ask you about conflict resolution and management, personal and professional values, leadership. Tom had mentioned some of the questions. Tell me about a time you had a difficult patient. Tell me about a time where a colleague came in to relieve you and was intoxicated. You know, those are kind of the moral conundrums are the things that they're going to ask you about. So again, these are, and for those of you that have been at the meeting, these are all really hot topics in what we're doing. Physician wellness, depression, suicide, team-based care, medical errors, all those things are really popular topics. So I'm going to hand it over to Renee. She's the Senior Director of Residency and Fellowship Program Solutions. And then Dr. Frazier is PhD, who's helping with this project, and they're going to tell you a little bit more from their side. So thanks.